Hi, you're watching the Savera. This is Amarpal Singh before you. DMCH Ludhiana, which is a leading medical institute of the North India, it is observing the annual convocation today where degrees have been conferred upon the medical graduates. We are having with us Sunil Kant Munjal, who is the president of DMCH Managing Committee. Welcome, sir, to the Savera. Sir, what message you want to give to the medical graduates?
I think the medical graduates have a unique opportunity today. One, the quantum of disease and the kind of disease that we are seeing, we've never seen before. So they can go out and serve society in many ways. Of course, from this level they are, many of them will go into higher education, many of them will go into super specialization. But even those who choose to stay MBBS and start to serve right away, I would say serve society, not just look at the medicine as a business. There is a huge opportunity to do good and to be good at the same time. They have the impact on society like almost no other profession because they touch our lives in so many ways. They get respected even before you actually talk to them because of just their profession and their qualification. They get the respect of society. So I hope and wish they go on to do many things, and at the same time remember serving society is one of the most noble things they can do in this profession.
Munjal sir, DMCH has already remained the leading institute in North India. So how DMCH is contributing to strengthen the healthcare system of entire Punjab as well as we can say the North India?
So DMCH has been very fortunate that when this was started 70 years ago, original was 90 years ago, 70 years ago, Managing Society was set up, which currently runs it. That our objective was to serve society with the best-in-class technology, process, equipment, and outcome. So we are unusual in the sense that we are a charitable, not-for-profit institution, but we operate at the best levels of systems, technology, equipment, etc., which is very unusual. And we also focus more on research than many other healthcare institutions, actually more than most institutions, which is why the institution continues to be recognized as one which is unique in its capacity, in its capability and its scale. It is also a very large institution which has both a medical college and a nursing college. The nursing college itself is unique in the sense of the way it is set up and the way it operates. So the hospital gets the advantage of the two colleges attached to it. And because we are focused on research, because we are focused on creating and retaining linkages with institutions, not just in India, but the best ones in the world, it gives us a unique window to provide the kind of healthcare which is hard to find elsewhere. Also, whenever you have any major incidents, like you had the floods now, or you had COVID earlier, or if you have any major other affliction, DMCH is normally the first port of call for most, at least in the northwest region of India. We do get patients from many other states, including also, of course, from overseas. And our attempt will continue to be to expand our reach, to increase our capabilities, and to provide excellence to the common man and common woman of the country.
Seats of MBBS has been increased by DMCH. So what new initiatives the DMC is taking?
So we are fortunate that we have just been cleared to increase the MBBS seats intake from 100 seats a year to 150 seats a year, which we hope to make active in this current admission batch itself. So from now on, annually we will have over 150 seats being admitted into MBBS, but we also have more postgraduate seats and undergraduate seats. In that sense, we are quite unusual. We are more like a PGI than most other institutions. So that helps us and gives us both the gravitas and the strength that as an institution, we can go on, continue to excel and continue to better every year than what we did in the previous year. Thank you very much.
So he was Sunil Kant Munjal, president of DMCH Managing Committee. So he mentioned that while giving the message to the medical graduates, he mentioned that they should do not consider medicine as their business. Their priority should be to serve the society. And he also mentioned the role of DMC in strengthening the healthcare system for in the Punjab, in the country, in the North India especially. So he mentioned that the DMC has always remained in the front foot whenever there was any medical emergency in the country or in the state. If we talk about the COVID, or if we talk about the present flood situation, so whenever there is any medical emergency, DMCS has already remained on the front foot and will always remain to serve the society. So this was Sunil Kant Munjal, President of DMCH Managing Committee. So you are watching The Savera. Stay tuned to us. Follow us both on Facebook and YouTube, and also download our mobile application. Amarpal Singh with cameraman Manoj Sidhu.